Now to COVID-19. With so many people having recovered from coronavirus, it's important to know that just means the person didn't die from it. While some have gotten back to normal, others are having to live with long-lasting changes to their health. 23 ABC's Vanya Patino spoke with local doctors about what long-term symptoms they are seeing and how variants are playing a role in that. Vanya.
That's right, Brianna. Well, we are 2 years into the pandemic and still there are people who haven't fully recovered. And I'm not talking about still having symptoms days after first having COVID. I'm talking about those people who still have symptoms 4 weeks after first contracting the virus.
And it can go on for years. Some people, have it now since the first wave. They still have some symptoms of it.
That is the reality some people are facing after getting COVID-19. Dr. Hemokathari with Mercy Hospital explains some symptoms are more common than others when it comes to long-term impacts.
Fatigue is a very common one. And then a lot of people talk about memory issues. They talk about this brain fog and recall, especially for short-term memory. So those are the two most common that we've seen.
Meanwhile, Dr. Parthiban Muninathan with Omni Family Health says he has seen those symptoms, plus shortness of breath and loss of taste and smell in his patients, and notes long-term effects are common in viruses.
Epstein-Barr virus, which is mononucleosis, sometimes that can linger. So the symptoms of that are fatigue, and that can linger for a very long time for some patients. So this is not unlike other viruses.
He adds that is why it is best to try to protect yourself from getting it in the first place or getting vaccinated to have a milder case of COVID.
Patients who had severe COVID or were hospitalized have higher chances of getting long COVID symptoms compared to patients who had mild symptoms.
But although Dr. Muninathan has seen severe cases of COVID tied to long symptoms, according to the CDC, 1 in 3 people who get COVID and were not admitted to the hospital do not fully recover by 3 months. And meanwhile, Dr. Kathari says they have noticed trends among different variants, like Delta causing more of the smell and taste issue than previous variants.
We definitely saw a lot with the Alpha and then with the Delta, but a lot less with Omicron.
He says this is because although Omicron was a lot more transmissible, it is much weaker in terms of symptoms.
That's always a good sign as well. I think as the virus weakens, the symptoms get better. They're not as harsh. And so I think if there is a next one, we have this sub-Omicron, I think you should see even less with that.
Well, to the million-dollar question is why some patients get it and some don't, adding that this impacts people of all ages and health conditions, but say that those answers will come with time. And now coming up on the news at 6, more on how COVID is also impacting the brain and what we can do at this point to help with that. In Central Bakersfield, Vanya Patino, 23 ABC News, connecting you.